Hello everybody and welcome to the Tuesday edition of Video Clips, and as usual I have announcements, and the first one is the HealthBriefs online library went live last week again, and I want to really thank all of you for being so patient, those of you who are subscribers to the library. In case you don't know what I'm talking about, every week I film these video clips, and the articles that I have written on the topics with all of the references are posted in the HealthBriefs online library. That way subscribers can get access to the articles and all the other ones that I've created over time. And so we wanted to move the library to a new location with a more sensitive search engine and categories, and I think you'll see if you have not yet logged in, we sent you your passcodes, how fabulous it is. But the only way to accomplish this was to take one article at a time and move it over, which is time consuming when you've been spending 15 or 20 years creating articles. So anyway, we're going to keep loading it up, but we reached critical mass last week and we went on ahead and made the library live. And then the second thing is for you guys who are in driving distance of Columbus, we're having a food over medicine intensive on Saturday, March 5th. It includes breakfast, lunch, appetizers, cooking class, intensive instruction on the information in the Food Over Medicine book, like diagnostic testing and diet and disease and how to manage your doctor. And we will have a special meeting for women who are part of our Operation Healthy Girlfriend group following the health intensive. So it's going to be a fabulous packed day. It's inexpensive. It's only $49 for the whole day, including all the food. And if you want to come the night before, we're going to have sort of an intimate little gourmet dinner the night before with Chef Dell. Anyway, if you want information about any of the stuff that I'm talking about, you guys know, call the office at 614-841-7700 or send me an email at pampopper@msn.com. Okay, so today let's talk about some head lice. How's that for a topic? Well, head lice are, first of all, parasitic insects that reside on the scalp and they feed on human blood. Adult lice are about the size of a sesame seed, and the nits or eggs are even smaller. Lice are spread from person to person, and of course children are particularly susceptible. If one of the kids in the class has lice, it's easily transmissible to other children. However, lice infestation, contrary to some mythology out there, doesn't have anything to do with personal hygiene. Lice don't spread disease. It's just a mostly childhood condition. Sooner or later, I think every grade school kid gets lice. Now, head lice don't go away, so you have to do something about it, and a lot of parents would prefer to use natural treatments instead of some of the insecticides out there. Tea tree oil, also known as melaleuca oil, comes from the leaves of the melaleuca tree, and it's used in a lot of products over the counter and as a disinfectant. In fact, we use it at our yoga studio to wash down the yoga mats that people rent from us when they come to class if they don't have their own mat. It's used in a lot of over-the-counter products, and it does have disinfectant qualities. It contains two constituents that have been proven to have insecticidal capability. In vitro, the oil was shown to kill 100% of all lice within 30 minutes. Now, studies have shown tea tree oil to be more effective than a whole lot of other commonly used solutions. Whereas researchers compared outcomes for 123 children who had head lice, and they were assigned to use one of three different products. One product contained tea tree oil and lavender. Another one contained insecticides, and then a third product contained benzyl alcohol and mineral oil. It was a suffocation product. It's used to suffocate the lice. At the end of all of the products were used according to the manufacturer's instructions, and at the end of the treatment period, the louse-free rate was 97.6% for the kids treated with both the tea tree lavender combination and for the suffocation product. The remission rate, interestingly enough, is only 25% for the insecticide product. By the way, the insecticide product was contained insecticides that are used in farming. Another study conducted by the same research group that did this study reported that tea tree oil and the suffocation product were moderately effective for preventing the hatching of eggs. For parents who want to avoid insecticides, if you want something that's really effective, just a little bit of petroleum jelly has been shown to have a 94% efficacy rate in terms of keeping the eggs from suffocating. Not very many side effects with tea tree oil. Kids will complain about things like burning the scalp a little bit or stinging, and a little bit of dry scalp as a result of using it. The American Academy of Pediatrics recommends against natural treatments and instead recommends the use of insecticide products. The evidence, however, shows that the use of natural products is actually more effective, and parents can allow their children to avoid chemical exposure by using those. The other thing that I chose to talk about today, and there are several references on this article. Next topic, same thing, well-referenced article here on indoor tanning and skin cancer. I get a lot of questions about this. Indoor tanning is promoted as a safe alternative to sun exposure and also promoted as a way to avoid sunburn. So you start tanning before you go to a beach vacation in the middle of the winter or something like that. But a growing body of evidence is showing that indoor tanning may increase the risk of skin cancer. It's not actually very safe. A study including 681 patients diagnosed with melanoma before age 50 showed that indoor tanning significantly increased the risk of melanoma skin cancer when compared to matched controls who didn't have the cancer. Women who were under the age of 40 reported starting indoor tanning when they were adolescents at an average age of 16, which is probably why they had melanoma at a young age. The women between 40 and 49 started at an average age of 25. The younger women tended to use indoor tanning more. They visited tanning beds an average of 100 sessions versus the older group of women only 40 sessions. Women under 30 who patronized tanning salons were 6 times more likely than non-tanners to develop melanoma than women in the comparison group, and the risk was dose dependent. The more episodes or the more sessions in the tanning bed, the higher the risk of melanoma. Melanoma on the trunk was also more common with the indoor tanning. Lead author Deanne Lazovich said that the results of the study were similar to another one that was done in Australia in 2011, showed exactly the same thing. She stated that the World Health Organization classified the radiation from tanning beds as a carcinogen in 2009. She added that the increased usage of tanning beds by women are far bigger users of tanning beds, explains why the melanoma rate is going up so much higher and faster in women than in men. Lazovich also said that melanomas on the trunk are more common in people who use tanning beds because when they're outdoors they tend to cover up more of their body. That's another sign that it's the tanning bed that is the problem. The use of indoor tanning, I think, should be discouraged. I discourage it in my office here. Instead, people should be educated as to, first of all, the benefits of sun exposure and then how to safely tan using sun. And the guidelines would include avoiding the use of sunscreen, limiting time in the sun in the beginning of season to like 15 or 20 minutes, then very gradually increasing your tolerance for being in the sun, and then covering up, sitting in the shade, or going indoors when you reach the limit of how much time you can spend in the sun without burning. Now, parental consent is required for minors to use tanning beds, but I think that the consent form should have a lot stronger wording, and I also think that the consent form should be required for adults. Language about the risks should be much more clear and stronger, and the benefits of sun exposure should be included. And I think if we gave people who were considering the use of tanning beds a really clear explanation of the risks and benefits, gosh, if we did that with everything in medicine, we'd see a whole lot less enthusiasm for a lot of these options. So anyway, that's all for today. As usual, pass this on to anybody who you think might enjoy watching it, and I'll be back to you Thursday with more news.